It's 9:15, the children are late for school, you're late for work, and one of your children is screaming with earache. And you're about to dial your surgery for the umpteenth time since 8 o'clock. So, how do you feel right now? Like a pressure cooker ready to explode? Frustrated? Wicked? This time, though, you get through. But what do you hear? Shopping music. I bet you're cursing quietly under your breath. Come on, pick up. You're not alone. We've all been there. We've all experienced this early morning insanity. And when you get through and are told that the first available appointment is in 2 days, well, I'll bet you could really throw a wobbler. What if you can't get what you want when you want it? You'll probably look elsewhere, like the walk-in centre, or worse, your local A&E department, for a condition that is definitely not an A or an E, thus shifting the pressure to another arm of the health system. From the GP's point of view, we hate that. Your condition may be an existing one, but it's unlikely to be added to your notes. These other health centres will not be making decisions with the support of your historical medical records. You might find it hard to believe, but we actually understand your frustration. After all, we have to deal with the flack you give our receptionists every day, just for doing their jobs. So, here in Dudley, the practices regularly get together to discuss the best way to deal with these pressures. We get to hear great ideas that other doctors use to provide you with better access. The simplest solution might appear to be employ more doctors and open longer. Some practices like Rangeways Road have given up their Thursday half day and are now open 5 full days a week. Other practices like Summerhill have added extra sessions into their working day. But just think about it. That alone won't fix the morning appointment booking mayhem. Sometimes the solution is to install better infrastructure. Bath Street, for instance, have installed more phone lines for peak time calls. Realise that, like everyone in the country, we're working on fixed and even shrinking budgets. So simply buying more is not an option. We wish it was. The Dudley practices have been very creative, utilising their limited resources in more efficient ways. The good news is we're all sharing our findings, so we can adopt the appropriate working strategies in our own way. You see, each practice is different. Each patient has different needs. Each surgery has a different population of patients. But the different ideas that have emerged are really neat. Listen to Dave's problem.
I am a migraine sufferer. The first time I think about a medication is when my migraine starts to come on. Unfortunately, the most effective medication for me is prescription only, and my surgery wanted me to call in with a request, which I picked up 2 days later. That simply wasn't good enough for me. I have since moved to Meadowbrook Road practice, and I can now order my repeat prescriptions online and book appointments too, which means that's one less call coming in that other patients don't have to compete with.
Other practices have been investigating different appointment types. And also they are using other healthcare professionals, such as nurses. There are basically 2 types of appointment: emergency appointments and regular healthcare appointments. For instance, a patient with asthma should come in once a year for a healthcare checkup. But if that same person gets a chest infection, they'll need an emergency appointment. So there has to be a balance between the 2 types. Some practices now offer appointments up to 8 weeks in advance. It used to be 2 to 4 weeks. This is great for regular healthcare checkups. Others have made sure that patients can book an urgent appointment throughout the day by opening extra slots. The surgeries operating this system have really eased the early morning rush. Some practices now offer telephone consultations. Great for problems like a sudden back pain when all you need is a prescription for painkillers, or when you just need some expert advice or reassurance. Sometimes a patient can be dealt with by a nurse. The Abbey practice appointed a nurse practitioner, and again that has removed the pressure on GPs. The doctors now have more time to spend with patients who need them most, such as those with long-term conditions. Listen to Mary at the Northway practice.
My surgery combined my last visit with a medication review. I'm asthmatic and I've been using my inhaler incorrectly. During my last visit, the doctor reviewed how and when I was using my inhaler. Now I know what I should be doing, so there is less risk that I will need an emergency appointment.
Each surgery needs to do what's right for their patients. Meet Edna from Musgrove Surgery.
I have multiple problems. I am diabetic and I have heart problems. My doctor wants to keep a close eye on me. I used to come in during normal surgery hours, generally twice, one for each condition. Then I received a letter to an afternoon clinic where we discussed all my conditions in one go. There was no rush and we could go through my medication and the side effects. It was reassuring to know that I could take my time and think about how I felt, without feeling that I had to rush because the next patient was waiting outside the door. You see, at my age, I get a little flustered and I tend to say that I'm fine, when really I'm not.
Some people visit their doctors for a chat. They're lonely. We encourage our patients to come and see us when they have problems, but we are doctors, not social workers. Castle Meadows Surgery realised that this was a real issue. Rather than ignore it, they referred these patients to the health and well-being team at the local council. This team have more time to spend with these patients. The well-being team can also keep an eye on their medical conditions. Now we work in partnership, referring backwards and forwards depending on whether the patient needs help or health care. A well person means less pressure for the GP. With all these initiatives, we need feedback to determine how we are doing. It's quite easy to measure. Basically, we just ask our patients, how are we doing? We developed the patient participation group. This invites both practice staff and patients to the meetings. The agenda is quite straightforward. How is the practice working for them and what needs to change? It's not too surprising that most practices now run a similar forum to measure performance. We know that we're not there yet, but in Dudley we're working really hard to get the most out of the limited resources that we have. Our objectives are to provide our patients with the right type of appointment with the appropriate health professional at the right time. Our patients say we're making progress, and with continuous feedback, we will keep improving.